Here now is Gwen. This is how Gwen was when I first met her, with her large ulcerated tumour, her large mass of nodes, and this tumour growing out from the area where her nipple used to be. This is 3 months later, and she has been treated with that drug, Herceptin. The big lump under the armpit is gone. The big lump where the nipple was is gone. The large patch of malignant tissue here has flattened out and is healing. So here is an experiment in one patient only, but a very dramatic one that shows that this treatment does work and is worthwhile. Here is the other lady I showed you. She also had this type of breast cancer with too much of the HER2 protein. And here are the before and after shots. This is a bit darker, but you can clearly see that many of the holes that were there have disappeared. And look at her lung now. The mass is gone, the fluid is gone, and she had become completely well. So this is translating what science has delivered into better treatments. So the problem in early breast cancer is shown in this slide here from my friend John Fletcher. Cases with normal amounts of the HER2 protein do well. Patients with early breast cancer with too much of this protein do not do well. And every time this curve falls, somebody has died. So this is a very significant endpoint. So if we can do what we showed in advanced breast cancer, can we do something in early breast cancer? And I just want to briefly talk to you about the HERA study, which involved 5,102 women from all around the world, including Australia, looking to see if Herceptin given early for early breast cancer, for non-metastatic breast cancer, would make a difference. And here is the disease-free survival, the risk of cancer coming back, and this is with 2 years of follow-up, so it's early. The risk of cancer coming back is reduced by 1/3. So the hazard of cancer coming back is about 64% less if you receive Herceptin. A 6.3% difference in absolute numbers, so 6 and a bit more patients alive at 3 years with the drug than without. Overall survival, although the lines here appear close together, is also different, with a decrease of 2.7% in absolute terms, or again a 1/3 risk reduction in the risk of death. So the promise in advanced cancer is now carried to early cancer. It didn't matter which of the Herceptin studies you looked at in this sort of thing, which is called a forest plot. If the blocks are to the left, it means the intervention worked. And here you have 5 studies. In every single case, the intervention has clearly worked in early breast cancer. So this is one of the great successes of recent research in cancer. And here is the survival benefit. This small study doesn't absolutely convincingly show a survival benefit, but the data is always consistent. So this is a very important step forward in the right direction. So the new biology has moved. We not only need our light microscope, but we need to understand what is happening at a molecular level in the tumour in order to select the best treatment for our patients. Drugs cost money, and these new biologic drugs cost a lot of money. And if you or one of your family were faced with this problem, you wouldn't like this particular scenario where the patient's going to be offered a useless drug. Modelling what happens out to a longer horizon suggests that somewhere between 13 and 18 patients per 100 treated will be alive at 15 years because of the intervention. So the improvement is somewhere between 13 and 18, depending on the settings that you use for the model. These are very, very important gains in terms of absolute survival. But the cost is around $50,000 to make that gain per patient treated. So the cost is not trivial. So cancer research involves not just advising what's the best question to ask, is it ethical, is the trial being well monitored and well conducted, not just asking the right question, initiating a protocol, conducting research or publishing results, but it is very important to change practice. Ultimately, if we do not change practice, all of this is for interest's sake, but the goal has to be to make things better. The Herceptin story is a very short one. The target molecule was only found in 1985. By 1995, studies were well in progress. By the year 2000, the drug had entered the clinic, and by 2005, we knew that it could save lives in early breast cancer. So this has been a very rapid development and assimilation of knowledge. And in October 2006, this treatment became available to Australian women. None of this would be possible without the patients who help us in research. And Donna is symbolic of those 5,102 patients that took part in this research. She is from Victoria. She was the first patient in the world to enter this study when many, many things were unknown. And it is a very clear partnership from many members of the community, not just treating doctors, but many different people that make research studies work. Thank you for your attention. I hope this information has helped you to understand some things about cancer.